Welcome to the Gastro Girl podcast. We bring together patients, experts, and health advocates who are all here to help you optimize your health. Here's your host, Jacqueline Garland.
Hey everyone, welcome back to the Gastro Girl podcast. Today's episode might completely change the way you think about your bowel habits. We're talking about pooping and why it's so difficult for so many people. We're welcoming back Dr. Tricia Pasricha, a Harvard-trained gastroenterologist and author of the book, You've Been Pooping All Wrong. Dr. Pasricha brings science, humor, and humanity to a topic that affects millions, but is still surrounded by confusion and stigma. Welcome, Dr. Pasricha. So great to have you on the show today. We're so glad to welcome you back.
I'm so excited to be back, so thank you for inviting me.
People ask this questions time and time again about their bowel movements, and the title of your upcoming book is called You've Been Pooping All Wrong, and you're here to explain all the ins and outs of this, and it's such a hot topic, embarrassing topic, but it's an important topic.
Absolutely.
So let's just jump right into it. I guess, first of all, what inspired you to write this book?
I was inspired to write this book really when I started practicing GI on my own after finishing my training and residency and fellowship. And I went into my clinics uh, thinking I was going to get a lot of really complicated questions about all of the GI physiology and nuances I had studied. And I did get some of that. But what really shocked me is that so many of the questions I was getting from my own patients were actually just basic questions about what is normal or not normal about their poop, or how many times a day should I go? What color should my poop be? And like these kinds of questions that I was like, wait a minute, how do you not know the answer to these questions? Like these feel like so basic. But the more like time went on, I was like, wait a minute, is the weird one here me and not you? Like, is it just weird that I have like grown up with, I have a father who's a gastroenterologist, and like we grew up talking about pooping my whole life and like learning about the gut brain connection. And so I was inspired to write this book just because I think we, not just as a country, like probably all over the world, don't do such a great job talking about our gut health openly and in the ways that people need to hear. Like, I think if we're going to talk about our digestive system or our gut health, we like really sanitize it with words. Like, for example, we call things bowel movement. Honestly, for the longest time, when I was using the word bowel movement with my like college student patients, a lot of the time they didn't know what I was saying for the first 5 minutes of the conversation. Like these are like words that people are like, this is, and you know, you and I were experts in this field. We talk about it all the time, but the average person, when they think about going to the bathroom, they're not like, well, let me go have a nice bowel movement right now. That's not how they're thinking about this. And so even the language we use is so distant from how people are thinking about it. And most people, after they get potty trained, which is in their toddler years, like they probably have never spoken to another living soul about the right sort of way to do it. Are they doing it correctly? Is what I'm doing different than what my best friend is doing? You don't know because you're not talking about it. But so much of our other bodily habits, like for example, how we brush our teeth, we talk about that all the time with our dentist. We check in every 6 months. They're like, hey, are you doing 2 minutes total? Are you doing every single side? Are you flossing? Like all of these things that are taught to us because it's normal, it's healthy, it's part of our lives. We learn a lot about how our reproductive system works in school. That's part of the curriculum. Nobody teaches us how to have a normal bowel movement, except for what we learned when we were 2 or 3 years old from our parents, which we have probably forgotten. And then we're just kind of winging it the rest of our lives. And so seeing that big gap between what I thought was common knowledge to everybody, but actually most people had never gotten that like 102 level college course on pooping, made me think, let me write a book that will just arm people with all of the information that I consider essential, that a lot of us in GI just think is normal, so that everyone can have a nice, healthier bowel movement. Because it's not as though everyone just has it under control. Like that would be one thing if we were to say like, well, you know, but this is, you know, everyone's healthy, like they're kind of getting through. Well, 40% of Americans say that their daily lives are disrupted by their bowel habits. So clearly, we don't have it under control. There's a huge number of people who can do a little better. And sometimes it doesn't take anything profound. It doesn't necessarily take a bunch of medicines or a whole lifestyle up. It just takes a little bit of knowledge and making small, simple tweaks that will just say, wow, like this whole time there's an easier, better way to do this. I just didn't know because I didn't ask and nobody asked me.
No, it makes total sense. I mean, I grew up with a grandmother, you know, the Italian grandmother who based her, whether she's having a good day or a bad day, on whether she was able to go to the bathroom. And I remember seeing all the Correctol and the Senecot and the laxatives. And, I didn't understand. I just knew that Nani doesn't feel good today. And why is that? Because she didn't go to the bathroom. So, and most people struggle. I mean, I can't tell you how many friends, girlfriends, and they know what I do. So they're always like asking me. I'm like, and you listen to the stories, and there's so much compassion for what they're going through because they're unhappy, they're miserable, and it affects their whole life. It totally does. And I think this is a great book. I can't wait for it to come out. I think it's going to really impact a lot of people's lives. But why do people feel like they're so bad at pooping?
Well,
No,
I think there's I think there are two kinds of people out there. Um, there are people who know they are struggling. And sometimes those are the people who make it to our clinics. They're looking for help, they're trying to get answers, they know they have a problem. And I actually think there's a lot more people who have just normalized their lot, like what they've experienced. They have a discomfort after they eat. They strain for 15 minutes at a time when they go to the bathroom. And they kind of actually think that's normal because they haven't compared notes with anyone else. And they've been living with it this way for so many years that they just think that's how it is. And so I think this book, what I hope it can do is it can help people who know that they need this book. They read the title and they're like, oh my gosh, this is me. But then I also hope it like reaches those people who read the title of this book and they say, "Hmm, have I been pooping all wrong?" Like there's like just a curiosity gap, and they might learn that actually what they've been doing, which they might even think is as good as it gets, there's a lot of room for improvement, and there's a lot of things they can do. And then you don't know how good your life can be. Sounds like Noni knew until you start having regular, healthy, comfortable bowel movements that become the absolute least of your daily concerns.
Yeah, and we're all about comparing each other, right? You compare it to your husband, well, he can go every morning, or your friend who goes every day. And why is frequency misleading? Like, why is frequency misleading?
Yeah, that's a really good question. There has been this myth that has been lurking in America since around the 1850s, 1850s, so almost 200 years ago, that going once a day was like the final word, was godlike. Try to go once a day. In fact, some of the earliest medical manuals that started to be printed in the early 1900s would even say, if you feel you need to go more often than once a day, hold it in. Hold it in
Oh
until the
my.
next day so that you have just once a day. And there's no rhyme or reason for why we came up with this idea that we need to have our once daily, but it is the number that has gotten passed down from generation to generation. And I also think that the reason that number has gotten passed down is because we have for generations not been having more open conversation about what's normal. But my colleagues at Beth Israel Deaconess Medical Center a couple of years ago did this study where they looked at a national survey of Americans who consider their bowel habits to be normal. And they said, well, how many times are you going? And as it turns out, anywhere from 3 times a day to once every 3 days is normal. But I have a lot of patients who tell me, like, if they'll come to me and they'll say, I'm worried I have diarrhea. And I'll say, "Well, how often are you going?" And in my mind, I'm thinking like 7, 8 times a day, and they'll say, "Oh, just twice a day or maybe 3 times a day." And it's a little soft, and you're like, "You know what? Sometimes there's nothing wrong with that. You just need a little bit of education that that's normal." And honestly, if you're eating a high fiber diet, which 95% of us are not, if you actually start to meet your fiber goals, which is what we want all our patients to do, which we want everyone to do, you're going to poop more often. Like you just have to embrace that new you and know that's normal. And then in parts of the world where the diet is really high in fiber, the average is not once a day. The average in those countries when they survey them is like twice a day. And that's totally normal. And nobody would blink an eye. In fact, if you said, "Oh, I only go once a day," they might be like, "Oh, maybe you are, is everything okay?" Whereas we think that's normal. So there's a range of frequency. I personally try to tell people not to obsess over any number. What's more important to me is that you're going in a way that is comfortable for you. That's the most important thing. Like if you go 3 times a day, but it's smooth, easy, it's like after you eat, maybe when you have coffee, great. And it's not interfering with your social life. Like you're not running away from or scared to go out to brunch with your friends because you're worried about the bathroom situation. That's a bad situation and we should work on that. But If it's 3 times a day, or if it's every other day, every third day, but you don't have bloating or discomfort, that's totally normal and you should live your best life.
So, and then there's this fixation around it, which, we can get into when you start talking about the gut and brain and how they communicate. But the expectations, I mean, you said in the 1800s, but where did it come from? Like, how do we get here? How do we get so fixated on this?
I think it's funny that like we use the word fixation. Like I do think a lot of us fixate on our bowel habits. Like that's just like a problem that we have that can actually become like an actual problem. But it's something we all think about for what started as good reason. Like having a bowel movement every day makes you feel like you've gotten the day started and you get rid of any of that discomfort or cramping or that feeling of like heaviness, and it starts you off well. I think the other reason why this idea of once a day possibly came around is that one of the most powerful stimulants of a bowel movement is actually really closely tied to our circadian rhythm. So our colon sort of follows a circadian rhythm just like the rest of our bodies. A lot of organs in our bodies don't do that. Like our heart is pumping no matter what time of day it is. Our colon goes to sleep at night. And in that first hour or two of waking up, it buzzes with activity, and that's when it starts contracting. And if you try to have a bowel movement in those first 1 or 2 hours of waking up, you're actually leaning into a moment when you're primed to do so, because instead of having to just bear down and do all the work yourself, your colon's squeezing too. So it's nice to try to time that at the same time. And I think that's where the idea of have a once daily bowel movement in the morning start partially came about, is because there is a lot of logic and reason for why that's the right time to do it. And that is a event that happens once a day. You wake up usually just once a day. But that doesn't mean that that's the only right way to do it. And it doesn't mean it's going to work for everybody. Like some people, the mornings are incredibly hectic and they like miss that window when their colon is contracting. Like the good news is that the colon does that. It has these like bursts of activity a couple times a day. It can do it when you drink coffee. Coffee is one of the strongest, most potent stimulants of those contractions. And it also does it after meals. Like if you, and that's why people often say like, why is it that I have to go to the bathroom after meal? That's actually because when you eat, that it stimulates this reflex that we think goes to the brain and then down to the colon. And then exercise. I mean, everyone knows that when you're trying to have a bowel movement, if you've been, if you go for like a brisk walk or a brisk run, that can often help move kind of everything along. So I think there are ways that we can, you can optimize having a bowel movement that's even not in that morning period if you wanted to. But I think that's how this like sort of mythology started about why once a day, and specifically like right after you wake up, felt like it was the right thing to do.
That's interesting about the circadian rhythm. So would you say that sleep and good sleep can impact your whole digestive health system?
Yeah, a really good question. So, absolutely. And there's two people that this is like an especially relevant conversation for. So, one, like night shift workers or people who do these like back and forth, like our nurses colleagues, they are dealing with this all the time. And then people who are traveling, like summer vacation coming up or spring vacation. When you travel, at least 40% of people, according to different studies, become constipated. Like we think about travelers' diarrhea a lot because people get food poisoning a lot, but we don't
Right.
talk so much about the fact that people get travelers' constipation really, really frequently. And that is exactly because your circadian rhythm gets thrown off. And partially tied to this question about our circadian clocks in our whole bodies. I mean, there have been these studies that have been done looking at night shift workers and people who change their day night schedules often. Those people are at an increased risk of things like colorectal cancer. And those links, we don't exactly understand those mechanisms yet, but one of the ideas is that circadian rhythm disruption can sort of increase overall inflammation in the body, and then that could contribute to those, not just colon cancer, but a lot of other negative outcomes for your health. When it comes to just having a bowel movement, your colon, the nerve cells in the colon, because our colon has this entire nervous system, the enteric nervous system that runs the length of the gut, those nerve cells each have a circadian clock that you need to respond to. And so when you disrupt that rhythm, they don't know when am I supposed to have these like moments of high amplitude contractions that normally they would have in the morning when you wake up. And so it can be very disruptive. And sometimes I tell my patients, if you're going on a trip, it would help you to try to reset your circadian clock as quickly as possible and to try to live the life that you lead at home normally even when you're traveling. So like when we travel, for example, we're on vacation, we might suddenly, we're people who normally wake up at 7 or 8 in the morning. Suddenly we're sleeping in till 10 or 12. We might skip our morning coffee. We're certainly not exercising it often. And then we ask ourselves 4 days into our vacation, why haven't I pooped yet? Well, it's because we've changed all of these factors that go into our normal routine and we're not doing any of them. And so sometimes I tell patients, even if it's just wake up and go for a walk on your beach, try to bring some of that normal rhythm back into your life. Your colon will thank you.
Oh, that's great advice. Now, this is one of my favorite areas is the connection between the brain and the gut and how they communicate. Can you explain that connection and why that matters for symptoms? Like what do patients really need to understand here?
I think that the symptom or the sign of the gut brain connection that I think everyone most easily identifies with is that sensation of like butterflies in your stomach when you're nervous. Or maybe it would be more akin to like a sinking cannonball in your stomach when you're like caught telling a lie or there's a bad situation going on. And that's probably the most recognizable idea about how the gut and the brain are connected. And I think a lot of people really think about the gut brain connection as how our emotions, how our anxiety, how our fear, our nervousness impacts our gut. And we see that a lot in disorders like irritable bowel syndrome, where anxiety can certainly make your GI symptoms worse. And I think the part that's has been underappreciated, but is now becoming more and more appreciated, is that it's really a two-way street. And it's not so much how much your brain impacts your gut, but how your gut influences your brain. One of the biggest and most important ways that these two systems communicate with each other is through the vagus nerves. The vagus nerve is this long, kind of super highway that connects the brain to the enteric nervous system and other organs in your body. And 90% of that signaling is not from the top down. It's not from the brain to the gut. It's from the gut to the brain. And we just need to kind of think about and listen to what those signals are saying a little bit more. And one reframe about irritable bowel syndrome that I write about in the book and that has really changed how I treat my patients and talk to my patients about this is that irritable bowel syndrome is obviously not all in your head. And it's not always so simple as to say, if we can get you on an antidepressant or we can get you some therapy and help you with stress and anxiety, then your gut symptoms will go away. Rarely, I think, is it ever like that or so simple. Now, those are parts of the treatment because we obviously, people with irritable bowel syndrome have high levels of anxiety and depression. Who wouldn't with a chronic medical condition? But I think it's important. I tell my patients there have been landmark studies that show that irritable bowel syndrome originates in the gut, that there is pathology in the gut that we need to treat and we can treat. And this is sometimes really novel to hear because until then, until that point in their lives, a lot of people with IBS have been told, all your tests are normal, all your tests are negative. There's no problem here. Like, why do you feel this way? And even gastroenterologists to some extent are like, okay, everything's normal. Let's get you on to psych treatment. And the field of neurogastroenterology, which is really people like myself who study the gut brain connection, that's over the last 20, 30 years have done so many studies that show, for example, if you were to give a human patient, or, and they've shown this even more elegantly in mice, a little bit of irritation to the stomach in those early formative years in childhood, those people grow up to become more sensitive to pain, more sensitive to stimuli from the outside that other people wouldn't consider uncomfortable or painful. And all that happened is that at some point in their childhood, there was a little bit of trauma to their stomach and something that like you or I wouldn't even remember as kids, much less as adults. For example, one of the studies that I sometimes tell people about was from the Swedish national cohort, where they looked at babies at birth who just had a little bit of gastric suctioning, like within hours of life. And then they grew up completely normally, no big medical issues. And they looked at how those kids behaved as adults compared to siblings who seemingly grew up in the same household, same kinds of environment. The ones who had that momentary bit of trauma to their stomach were more likely to be hypervigilant, hypersensitive, and have these kinds of disorders of their gut. And anyone who had done these kinds of tests that we do on people, like upper endoscopies, blood work, all these things, everything would have looked totally normal. And it was only because they dug deep in that chart that they realized that there was something that had happened in their childhood. And so sometimes we're not going to be able to find the answer for any one person who's sitting in front of us. But what we do know and what I can tell people is that oftentimes there is a trigger. There has been a trigger in childhood. What happens in our childhood, as we know, not just in GI, but in lots of different fields, really has this outsized impact on who we become as adults. And we often think about how our anxiety causes our irritable bowel syndrome, but actually it's this gut injury that causes the irritable bowel syndrome and then later on triggers anxiety and depression. And I think the treatment can and should be a mix of both, of addressing the issue in the brain and also the issues in the gut. And we've kind of long neglected the issues in the gut.
No, it makes a lot of sense. Um, and what about we always talk about this, the impact of stress, and how does this relate to someone's ability to, feel like they're having complete evacuation, or that they're not having the bloating and the cramping that could come along with some constipation issues?
Yeah. So stress is a really important idea and concept in our field. So some of the best and most interesting studies on stress and the gut actually came from the 1950s. So, in the 1950s, there was this researcher from Cornell who did this series of experiments on Cornell medical students, which, by the way, we could never do studies on medical students again. That is like kind of unethical. But at that time, what he did was invited these medical students into the lab, and he basically gave them these psychological stressors or tests. Like, so he would tell them as he was looking in their colon with kind of an early prototype of a colonoscope. So, looking at what's happening inside their colon in real time as they're awake and they're just talking, he would say, "Oh gosh, it looks like we see this lesion. It looks a little concerning." And he would kind of describe it in a way that would suggest that he's identifying colon cancer. And as he's talking about this stressful situation, and the med student is listening and becoming more stressed that they've caught a cancer, this researcher from Cornell would watch as the colon started to contract and cause those cramps that we all know when we're feeling really stressed. And it would kind of become hyperactive. And then when he told the medical student, "You know what, just kidding. The whole thing was just a test. There's no cancer. Your colon looked great." Suddenly he could watch the whole colon just relax and stop cramping and stop moving. And he did this over and over again. So he would sometimes have the medical student, he'd like deliberately have them talk about a stressful situation, like their husband who had an alcohol use disorder. He would like provoke them to talk about it. And as they started talking about these stressful life situations, he would watch as their colon moved. And those early studies were some of the best, most descriptive ways that we found that direct connection between stress and the gut. Later on, researchers did more experiments to find that what the mechanisms were. And so what we know is that when we're stressed, we not only release through the adrenal glands this hormone called cortisol, which is the stress hormone, but our brains also trigger a lot of changes in our gut that are completely independent of cortisol. One of them is that it increases intestinal permeability. And we've talked about this, I think, before on the podcast. Intestinal permeability is tied a little bit into what I think in popular layman's terms people call leaky gut. But if we strictly go by this criteria where just those tight junctions open up, it means that when you're under stress, you have this inflammatory response right there in the gut that causes whatever you've kind of ingested and is hanging out in your gut, the bacteria, all of the inflammatory cells to move in and out. That can be uncomfortable. And some of that, the reason we do that is actually because the inflammation can be helpful in some sense to kind of respond to what we perceive as a threat. But it comes with all these side effects, especially if that perceived threat doesn't go away. And so we know that that connection between stress causes very real changes, not just in our bodies, but directly in our guts. But we also know the reverse is true. We also know that injuries directly to the gut can trigger stress. And in studies that they've done of mice, for example, if they irritate the colon in a model of irritable bowel syndrome in rats, um, they will find that those rats grow up to exhibit more behaviors that show more depression, more anxiety than rats who, as babies, didn't receive that little bit of irritation to their colon. They've also found that if you sever the vagus nerve, which is that highway that connects the brain and the gut, then suddenly that anxiety and depression goes away. That those rats that had experienced that trauma to their gut don't develop anxiety and depression anymore, despite having received that injury. So we know that this is a two-way street, and it's really important that we think about both.
There are people who struggle with IBS, And we could have a whole conversation just about IBS and the role of bowel movements. But for those who are just day to day struggling, and they could have IBS, and maybe they'll learn, you know, uh, what are some of the signs that someone should ask their doctor based on their bowel habits if they could possibly have IBS?
Yeah, I mean, I think anybody who is struggling with their bowel movements in any way, like it's interfering with their social life, it's interfering with their ability to have a comfortable day, should talk to their doctor. Some signs of IBS specifically would be if you have pain or a lot of discomfort associated with your bowel movements. And IBS can be constipation, it can be diarrhea, it can be a mix. Like sometimes it can be diarrhea, sometimes it can be constipation. There's often not one clear pattern that lasts for years. It can flip back and forth. But if it's causing you a lot of discomfort, it's worth talking to your doctor because despite what I think the narrative had been for people for decades, we actually do have a lot of targeted treatments out there and we can help you that are not just like, oh, take some Imodium or some
Right.
antidiarrheals. Like we have ways to treat it. So and then certainly like other like bigger red flag symptoms would be like if you have any blood in your stool, then like absolutely should talk to your doctor sooner rather than later.
Um, and you, this is so interesting. You introduced the concept of poophoria. Poophoria. So am I saying that correctly?
Pooforia. Oh yeah.
Poophoria. What does that mean?
Yeah, well, Pooforia is not just where you're having a bowel movement and worried every day, like, am I going to be able to make it to the bathroom in time? Am I going to have a lot of discomfort after this next good meal coming out? Pooforia is this state of living where you never really think about your bowel movements again. You know, like you go, you have your bowel movement, you're in and out within minutes, and it's the like least biggest concern on your mind as opposed to a lot of people who, if they go into the bathroom, like they're going to be in there for 15, 20 minutes to God forbid, like an hour. Or they're scared to go out and socialize. They're worried, I can't even walk my dog because I'm worried about the bathroom situation, or I have to make it back in time and I'm not going to make it. Um, what I want everyone who reads this book to achieve Pooforia. And I want you to not be in that 40% of Americans who feel like their lives are disrupted by it. And sometimes, you know, the way to get there are just very simple fixes. Like, so one framework that I introduce in the book is called the 3 Ps of pooping. And I think this is like a really important framework that nobody has taught you. And what those Ps are propulsion, pliability, and the pelvic floor. And the way I think about pooping is like you are trying to get toothpaste out of a toothpaste tube. And sometimes we think a lot about the squeezing of the toothpaste tube. You have to do that. Or how soft the toothpaste is. And sometimes people think that if they take laxatives or things like that, that'll soften up their poop. But we almost never have a conversation out loud about the pelvic floor. And that is like literally taking the cap off the toothpaste tube. And sometimes if all we focus on are the squeezing or the pliability of the stool, but we don't have a conversation about the pelvic floor, you're just going to be pushing against this closed wall. And we see that all the time. And in fact, about 1 in 5 people who have constipation actually have a pelvic floor issue. And their problems would be solved if we address that instead. So it's very common. About 7% of the population have pelvic floor dysfunction of some kind. And it's one of those things that happens without you even really thinking it's happening. I think sometimes when we say the word pelvic floor dysfunction, what people think about are like women who have gone through childbirth. That is very common that they get a kind of pelvic floor dysfunction, but that's not what I'm talking about here. Pelvic floor dysfunction can come about just because you have been living your life, and at some point, maybe in your teenage years, college years, you become constipated. You're eating a typical Western diet, and you start to strain more to have a bowel movement. And as you strain more and you're bearing down, you actually start to squeeze those muscles in your pelvic floor rather than relax them. And it's this big paradox in how we have a bowel movement that you have to relax certain muscles in your pelvic floor at the same time that you're generating all this pressure to have a bowel movement. And if you are constipated for any number of reasons, sometimes you retrain those muscles without consciously knowing it to contract and just form an even harder barrier against having a bowel movement. so that even later, when you discover kale smoothies and a high fiber life, you fix the thing that was causing the problem in the first place, but now your pelvic floor has been retrained and is working against you. And this is kind of a classic story we see all the time. And sometimes just retraining those muscles, which you can do with pelvic floor physical therapy, is like bursting open this dam. And finally, people are able to just have normal bowel movements. And it turns out they didn't need 10 laxatives, they just needed to retrain those muscles.
And you talk about reframing this as a body process and not a performance.
Yeah. Yeah, I mean, this is like our I mean, I think it's unfortunate to us that we have not had this conversation about just like a normal process that's happening in our bodies. I also don't I think it's hard to teach our kids about it when we ourselves didn't get like a great
Right.
lesson plan from our own parents.
Yeah.
And so it's like it's nice. So I think this book, I mean, sometimes a very common scenario I see in my clinic is people come in having been dragged in by their spouse, and the patient will say like, I don't really have a problem. I go to the bathroom, and the spouse will be like, no, you were in the bathroom for like 60 minutes every time you go, like, you have a
Oh, no.
problem. And you just don't know that until you marry somebody who has a totally different bowel habit than you, and now you're living with them for the first time, and you're really seeing that other people don't live like you, and that person thinks you're weird, and then you think they're weird, and now nobody knows who's right.
So, so what are a few simple changes that people can try today to support better bowel movements?
There's several. So one that I talk about often and that my lab has studied is do not take your smartphone into the bathroom. Okay, this is really counterintuitive because we're all doing it. We take our smartphones everywhere. We take them to sleep. We bring them to the dining table. We know we're not supposed to do that. We really need to be saying just as loudly, we don't take them to the bathroom. And the reason why is that we did this study at Beth Israel where we looked at people who use their smartphones on the toilet, and we found that the ones who did were more than 5 times as likely to spend more than 5 minutes at a time in the bathroom. And that makes total sense because when you are on the phone, you are getting distracted and you are scrolling and you're getting sucked into this TikTok, just as you are when you're sitting on your couch, except now you're sitting on the toilet on this open bowl and you have no pelvic floor support, and you've kind of lost track of like why you went into the bathroom
Right.
in the first place. And we found that people who did that had a higher risk of getting hemorrhoids than the people who didn't bring their smote in. So that's one thing is I tell people first, try not to spend more than 5 minutes at a time in the bathroom. One of the easiest ways to help yourself do that is to not bring your phone in. Second, if we want to address the pelvic floor, all of us would benefit from just raising our knees above the level of the waist. So in the past, the like really traditional way of having a bowel movement was squatting. It was not sitting on a throne. It was like not sitting in this like perfect 90-degree angle that we do now. And the reason why squatting was a superior position to having a bowel movement, now it's also like uncomfortable. There's like balance issues. There's like lots of reasons why we don't love squatting now, but we've actually harmed ourselves in terms of like the reason we went into the bathroom in the first place. If you think about the end of the colon is like this long tube, there is this muscle that looks like a sling that kind of goes around the tube and it chokes it off. So it like pulls a kink into it. When we squat, that muscle relaxes so that the tube can straighten up again and you can allow the contents to pass through. But when we're sitting at a 90-degree angle, we're actually choking off that tube so that we have to push even harder to overcome it. So the simplest fix is to just put a stool underneath your legs and raise those legs up. You don't necessarily need to buy anything special. You could just get a stack of books or wear high heels, like whatever you want to do, but raise those knees above the level of the waist. And that can help very quickly if you were struggling, make things a lot easier.
That's a great tip. Anything else?
Well, I think the big picture conversation that we need to have is that we don't have enough fiber in our diet, and that we get like 60% of our food from ultra processed foods, and those are pro-inflammatory foods. If we ate more fiber, I think a lot of our problems and discussions about bowel movements would actually just go away. But it's so hard to do that.
What do you tell your patients? Like, how can we get more fiber? What's an easy and accessible way to get more fiber? Do we take some of those supplements? Other foods?
Yeah. I tell people two things. Like, switching your diet is really hard. And I'm not doing you a favor if I tell you it has to be all or nothing, like swap out all your white bread for whole grain wheat bread and, like
Right.
never touch like like all of the good, yummy pastas that we love again, then no one's going to stick with that. But I think if you can make small changes, so fiber supplements are great. Like I like just old fashioned psyllium husk. That's been really well studied. It can help with your bowel movements. It also helps lower your cholesterol. So I talk about psyllium husk a lot. If you do nothing else, like just add a fiber supplement. But specifically for bowel movements, if you want to just have better bowel movements, try adding 2 kiwis a day to your diet. They're great for the fiber, so get a little boost of fiber. But randomized control trials have shown that 2 kiwis a day help people have more frequent, comfortable bowel movements, but don't cause bloating. So, like in
Right.
our grandparents' time, they were like, "Oh, have prunes," and prunes work incredibly well. They're also high fiber. Um, but first of all, like, have you ever tried to get a college student to eat more prunes? Like, it'll never happen. And prunes often cause bloating, and that's why a lot of people don't like sticking with them. Kiwis don't do that, and there's very good data to support that. So, if you are like not ready to take the full leap away from whatever pattern you're eating right now, and I get that that can be really hard. Sometimes thinking about more like what you're going to add in rather than what you're going to take away can be helpful, and add in things like a fiber supplement or 2 kiwis to your breakfast.
Great. And if listeners could remember one thing from this conversation, what should it be?
I think it should be that bowel problems are really common, even though we're not talking about them out loud as much as we should, and that even if you have been told all your tests are normal, that doesn't mean that everything's normal. It's not. It means that we haven't done the right tests and we're not looking in the right spot.
Oh, this is great. Thank you, Dr. Peshricha. Where can people get your book and when does it drop?
It drops April 7th of this year. Really excited. They can get it anywhere there buy books, bookstores, Amazon, Barnes and Noble. Yeah, I would love to know what people think, so they can certainly send me a message.
Great. And thank you so much for listening to the Gastro Girl podcast. If you found this episode helpful, please like, share, and subscribe to our channel. And if you know someone that is struggling with their bowel movements, please share this episode. Thank you so much, and we'll see you next time.
Thank you for listening to the Gastro Girl podcast. For more information and resources, please visit gastrogirl.com. Do you have a question for Gastro Girl? Please email podcast@gastrogirl.com. The information, opinions, and recommendations presented in the Gastro Girl podcast are not a substitute for medical advice from your healthcare professional. Please consult a licensed clinician in your state regarding all matters related to your health.